I'd like to start by welcoming everybody who's joining us tonight. This is Michael from Blue Sky Bio. For tonight's lecture, I would like to introduce Dr. Lambert Stumple. Dr. Stumple is the author of over 25 scientific publications and a frequent lecturer. He's the developer of the 3D Click Guides, a fascinating model-based guided surgical system which he will be presenting and explaining to us tonight. Dr. Stumple, thank you for joining us. Please go ahead.
Well, thank you, Michael. Welcome everybody from San Francisco. But you're obviously now looking at is our Golden Gate Bridge. But what some of you might not know, that the Golden Gate Bridge just had its birthday. Okay, Michael. There we go. And so we had fireworks all over the place, not that long ago. Before I start, I would actually like to thank our friends at Blue Sky Bio to be so kind to host this webinar tonight. So thank you, Michael, and much appreciated. The title for today's presentation is the 3D Click Guide, and the 3D Click Guide is a fully restrictive, adjustable surgical guide intended for 1 and 2 implants. What does that mean? It is a surgical guide where everything has been determined before you go into surgery, which is very different from conventional surgery where things are determined on the spot. So what we have with 1 or 2 implants sounds small, but actually is a very, very large part of what you and I do on a regular basis. If we look at these numbers...
I'm sorry, let me jump in. I think you accidentally paused the screen sharing.
Oh. Resume sharing?
Yes, exactly.
Are we good now?
Yeah, I believe so. Yeah, perfect. Thank you.
All right. Okay, I apologize, everybody, but I pushed the wrong button. As we see in these numbers are both from Noble Biocare, as they are from Glidewell or Glidewell. In the last 70,000 cases, 87% of their cases were 1 or 2 implants, and Nobel tells me that basically worldwide, about 80% of the cases are 1 to 2 implants. So why would you care to have a surgical guide for just 1C or 2C, as people say? Well, maybe because it's not as easy as it might appear. And here you see an example of an implant being placed, and obviously fine and also indicated, and it has been restored, but it's not in the ideal position. Here we see a few more of that, where the implants clearly have osseointegrated, but are not exactly in the right position where ideally you would like to see it. Another case presented into my office where this gentleman years ago fell on his face, lost 1 tooth and got an implant, but you can see the other central incisor has a resorption, so eventually he presented and the tooth had to be extracted. So he had a very good experience with the previous periodontist who took the tooth out, grafted it, and 4 months later placed the implant. Then when I got the patient back, things looked like this. So here you can see that even for somebody who has a lot of experience, it's not always that easy to get it into the right spot. If we look at dental implants, many of you have been involved with that for some time. Old-timers know that in the early days there was a big discussion of 1 implant would actually work over another. I think by now we kind of know that most dental implants will work and will do fine. What is still the barrier and what is still the difficulty that we have is how do you get that implant from the little sterile vial that we have in our hand into exactly the right spot into the patient's mouth. And so I believe that guided surgery, be that model-based or computer-based, will allow us to present that with more confidence most of the time. And so if we see that a fully restrictive surgical guide, and fully restrictive means that everything of the three-dimensional position of that implant has been determined beforehand. If you have like a little vacuum form and you know where the central fossa is, then you will still need a lot of skill to bring it in the spot, because during surgery you'll have to make decisions and you have to place that implant in the right spot. If you have a fully restricted surgical guide, as you, for instance, have with the computer, or if you have, in this case, with a 3D click guide, then everything has been determined beforehand. So what it means is you do not need the same amount of experience to get that implant in the right spot every time. You still have to know where the implant should be, because you have to plan it beforehand. And so what it will do, it will allow us, a much larger group of patients, a much larger group of clinicians, give care to their patients. So if we now look, what are the two options in fully restrictive guide, and we have a model-based version and we have a computer-based version. If we look at the computer-based version, here you see an example of that, where you have a single site missing, and with cone beam CT or CT information, you will now be able to generate most often a stereolithographically produced surgical guide. So does that work? Absolutely. But if we look at some of the economics, then where I live here in San Francisco, I have to pay $400 for a cone beam. I know that in different areas of the country that might be a little bit less, but very likely it will not be much less than $300 or $200, because these machines are still $150,000. In the older version, we still needed a scan prosthesis. That obviously depends on how you do things. If we look at the cost from Noble Biocare or from Simplant, it's about $400. A pathology report is good advice, but I don't know how many people do. But if you look at it, it would be about $1,000. Now, if you look, for instance, Blue Sky plan, and you would use it with Roe Dental Lab, I say $710. And why do I say that? Because I still have to pay $400 to my cone beam lab to make that, where Roe will charge you $310. So obviously, if you use a computer, you will need to give information to the computer. That information comes from a scan, and a scan obviously is radiation, and these numbers do vary, and people do get more or less hung up on that. If we look at the 3D click guide, which is a model-based concept that can be done for about $150, $160, and you can do it in one visit if you want, and we can obviously go over that extensively tonight. You will need one or maybe two radiographs, so 1, 2, 3, 4 microsieverts. Obviously, a low radiographic dose of ionizing radiation. What I wanted to do is I wanted to start with the end inside, because this is how the 3D click guide looks, which obviously is very different than what most people are used to. And so if we have a look at how we get there, then we see that what it will do for me, I can do the procedure at the same day. Patient comes in, breaks a tooth. If I want to, an hour later, the implant can be in place. Obviously, if you have a guide being made somewhere else, that will take more time. Most of the time, and I say in my hands 98% of the time, I'm not using cone beam CT data for that. I use simple bone sounding. But you can combine this with a cone beam quite easily. Tonight, we will not have time to go over that, but I'll show you some articles that I wrote, and you can look it up on our website. The system is compatible with any root form implant. It really makes no difference. You drill a hole in bone, or as they call it, an osteotomy. The bone doesn't know who sold you the drills, and once you have an osteotomy, the implant doesn't know how the osteotomy got there. So any implant system will work if you have the correct drilling protocol. One of the things, as we discussed, is the big advantage, as I see it, is that all the three parameters, all the three planes of this dental implant have been determined outside of the mouth without stress, without spit, without blood. And so each part of the position of that implant is determined individually, basically on the bench. I can pre-make provisionals and abutments initially for people not very skilled. That's not where you want to be, but this is more for the high-end people who would normally not use surgical guide for 1 or 2 implants and see no reason for it, can have a real application if they want to do immediate load, where you pre-make the provisional before you go into the procedure, or where you actually pre-make the final abutment and where you have a one abutment, one-time situation, so you can deliver the final abutment at the time of implant placement. And one of the things, but that is that this is actually a retentive surgical guide. What that means is that if you place surgical guide in place, then it snaps over the height and contour of the teeth and will not fall out. If you have a computer-generated guide, because it's stereolithographically produced, which is a composite, then it has to be above the height and contour, and so you have to make sure you keep that guide in place. That guide obviously has to be exactly in the same place where you intended it. Otherwise, the implant will end up on a different position than where you want it to be. Now, as Michael already said, we have a website, and I want to show this to you because what we can show tonight in this presentation is just a limited amount of information, and there is really an enormous amount available for you. This is on the website 3dclickguide.com. You're looking at the landing page where you will get there. We have a large training section where you have videos from how to make a guide to how to use a guide. We have, if you want to get your head around the concept, because it's a concept that is different than what you're used to. But once you get your head around the concept, then there will be 50, 60 clinical cases, different implant systems, different philosophies, essentially variations on a theme. Then if you are a dental technician or if you're a dentist who is not willing to do some of the little of lab work that you have, you can have your dental technician do this. And this is a communication tool that we have. Then obviously, finally, we obviously want to sell this, and so we have a store where you can buy this. So once you buy this, you will basically get a kit. One kit is for 1 implant. So the kit that you see is for 1 dental implant. You will need, with this system, you will need drill guides. And drill guides essentially will reduce the size of the hole in the surgical guide, and we'll talk about it in just a little bit, to the size of the drill that you're going to be using. So quite often you start with a 2 or a 2.2 millimeter drill, and sequentially you build that up to a larger size, depending on the size of the implant you're going to be using, depending on the resistance of the bone that you encounter. So if we look at the different sizing that we essentially have 3 different sizes. We have a narrow, and you will use that for lower centrals, lower laterals, upper laterals, essentially areas where you have limited mesiodistal space. Then we have a regular diameter, and a regular diameter is 5.05 millimeters. These numbers are compatible with the systems from Noble Biocare, from Straumann, and from Implant Direct. They are not compatible with Zimmer, Astra, and 3i. That doesn't mean that you cannot place these implants, but you cannot use the drill guides from these companies. They are 0.5 of a millimeter, 0.7 of a millimeter different, just to make things handy for us. Then if you really want to place larger implants, and I see myself do that less today than I did a few years ago, then we have also available a wide diameter. Now, everything together will look like this, and then we will talk about the different rotation blocks that will go in there. So what I'll do right now, these are some screenshots from an animated movie that you can find on our website, and we'll go over the little steps one by one, so then